Doctor, how bad is this? Are you expecting daily deaths to continue to rise as our data indicates they will?
Yeah, Shep, so thank you for having me on. Unfortunately, I am. I think the horrible death numbers we're seeing now, they are going to get meaningfully worse in the weeks and unfortunately even in the next couple of months ahead.
Here's the biggest concern. As detailed in a report today from Ed Yong in the Atlantic magazine, when hospitals are full, and many of the best prepared in this nation are full or getting there, patients will die waiting to get in. So they'll die not just because of the virus, but because there's nobody and no place to help them. Dr. Jha, can that sort of reality, widespread, be prevented?
Yeah, no, this is a huge issue, Shep. I mean, remember, I always remind people hospitals existed before the COVID pandemic. We need hospitals for lots of other things. And when hospitals get crowded and other people can't get care, it becomes a huge problem. Of course, the best way to prevent it is to prevent hospitalizations for COVID, prevent the disease itself. There's a lot more we can do to try to manage the crowding that's starting to happen. But there's no doubt about it, crowding in hospitals leads to higher fatality rates for everybody.
I ask because of things that we know. We know deaths lag hospitalizations, just as you said, and hospitalizations lag cases. Cases are exploding and have been for weeks. Based on today's numbers, 2 weeks from now, more hospitals will full. And by the week before Christmas, even more, till the healthcare system eventually collapses. With the case numbers like they are, you do the math. Is that inevitable, doctor?
Well, I would say based on the infections we have today, we're generating almost 200,000 new infections. 2,000 to 2,500 deaths a day is already sort of baked into the system. That is almost surely going to happen. The big question in front of us is how much worse are we be tolerating letting this go? And that's really what we need to prevent, Shep. We need to prevent further increases in cases so that we can top off at those horrible numbers and start coming down.
Especially over Thanksgiving. Doctor, in June, you predicted here that more than 200,000 people in America would die by right now of COVID. Instead, more than 250,000 have died. Where does the data lead you to believe we'll be by springtime?
Yeah. So, this is obviously one of those situations where I was hoping I was wrong in the other direction, and unfortunately, it's been worse than I predicted. I see another 100,000 deaths by Inauguration Day. And once we get into the spring, we easily could be at 450 or even 500,000 deaths. That all depends on us, right? If we do things that are smart, we can avoid that. But if we don't, we could easily get into the 400,000 to 500,000 deaths total, which is absolutely astronomical.
Shepard Smith here. Thanks for watching CNBC on YouTube.